We are contributing our parts and have aligned ourselves to the WHO global strategy, which is to reduce physical inactivity by 10% worldwide. So we believe that this complete program, which is being carried out, will bring efforts to reduce or to contain the mortality rate caused by NCD.
Good day, everyone. I am Misha Irina, the Organizing and Scientific Committee members on Exercise Medicine and your host for today's episode. I would like to welcome all of you to the WCEM podcast. We are here again to discuss on non-communicable diseases, NCDs, and exercise medicine related to our conference this year with the theme Living with COVID-19, Changing Lifestyle Combating NCDs. If you are new here, World Conference on Exercise Medicine have gathered participation of 59 speakers, from medical experts to exercise scientists from 32 countries all around the world to share the knowledges and contribute the parts in combating NCDs. Today, the podcast will be surrounding on the topic of exercise and aging. In this topic, we bring you our respective guests, a professor of sport medicine at Faculty of Physical Education and Sport of Comenius University in Bratislava, Slovakia. He is also the chairman of the Scientific Commission and elected member of Executive Committee on International Federation of Sport Medicine, FIMS, and his field of interest is on how to work on strength. This man is a wealth of information when it comes to the physiology of aging. So grab your notebook and pen, take a sip of coffee as we welcome our guest for today's podcast, Professor Dr. Dusan Hamar. Hi, Doctor.
Hello, nice, nice introduction. Thank you.
All right, so Doctor, how are you doing right now?
I'm fine and overcoming this COVID situation, but actually the life is coming back to normal. And, at my faculty, we have been dealing with the effects of exercise, various forms of exercise in elderly for more than a decade. And we keep going, we keep continue right now. We focused on the topic of the balance. As we know that the balance is deteriorating with the age, and that increases the risk of falling. It increases dramatically over the 65. You've got like 30% people annually, they fall. Over 80, it's more than 50%. And almost 5% of those people who fall, they can suffer some kind of injury like fracture, which can be really serious. So it has consequences not only on personal life, but also like social, economical. Increases the cost of healthcare and so on. So the prevention of falls is really an issue which is very interesting now. And one of the steps to do so is that we have appropriate method for the assessment of balance, of its deterioration. And of course, we could use some simple traditional method like motor testing, but it's better if you can use some more sophisticated, more precise systems which can evaluate the balance. And the problem is that most of those systems used nowadays, they are quite costly. They are based on posturographic platforms, and they analyze the center of pressure by taking the measuring the force imposed in 3 or 4 corners of the platform. And our approach is different, so we'd like to design. We have designed the system which is more simple. It's based on a platform which is on the springs, and we take the inclination of those platform in like two layers, and we use very simple system to measure this inclination. It's called like inertial measurement. It used to be very expensive, but nowadays it's much easier to get. It's not so expensive. And in this way we created a system which is not so expensive, and so we try to to find out what is the reliability of the system, and of course also to have the norms for the various population groups in order to use this for the screening examinations.
Okay, so doctor, you have talked about falling. So when it comes to aging, as we grow old, our body will start to lose its function, and one of it is balance. So in this context, can you share with us what is the effect of falling, especially to the elderly population?
As I mentioned, there's an increased risk of falling due to the disturbance or deterioration of balance capabilities. And, the high percentage of those people, I mean, they suffer the fracture. And some of those fracture can be really serious. If you take the fracture of the hip, then it can be, especially in the past when they used mostly conservative treatment and the patient had to stay in bed for almost like 2 months. And the risk of getting some complication and even to die was so high that nowadays, even the elderly, very old people, like 85, 90 years old people, they do operate on these patients because it's lower risk than this conservative treatment. So these are serious situations which have a detrimental effect not only like on personal life of those people, because I mean they steal like half a year of their life in some way, in better case, because I mean they could die. So, and also it has a consequences on the healthcare system, because it costs really a lot to treat these kind of injuries. So of course it's prevention in this term is much better than anything else.
So when you talk about preventing, so how to prevent risk of falling, in your opinion, doctor?
That's a good question. We already know, it results from our studies that just a pure, simple resistance training, strength training, already improves the balance capabilities. And that's because you improve this effector, the muscles, they are used, to compensate some disturbance of the balance in the case you slip or you do some jerky movement. But when the muscles are weak, then this compensation action is not efficient enough, and people tend to fall. So simply increasing the muscle force, muscle strength is a way, to prevent falling. The other options we are testing now is that how far you can also improve the balance capability if you try to affect this sensomotor part of the process of maintaining balance. First you have a perception of some disturbance, and then the central nervous system makes the assessment, and then through the muscles it reacts. So we know that if you affect the muscles, you can improve the balance. Now we try to look at whether if you just focus on this sensomotor part, or this afferent part, whether it works as well in terms of improving balance capabilities, or even more, if you combine those two, if you combine like, strength training with this sensomotor training, whether it's kind of potential effects, and you have even better improvement of balance. So this is part of our activities nowadays.
So yeah, thank you, Doctor. It's very great explanation. So how does resistance training benefits to the aging population? Because in Malaysia, we have a very, not all elderly population have this awareness on the benefits of resistance training. So Doctor, can you please share to us, how does resistance training give benefits to the elderly population?
Unfortunately, it's not only general population, but still a lot of, my colleagues, they are still like very cautious, with the resistance training for elderly, despite of the fact that nowadays we have a really great amount of evidence that this is greatly beneficial activities for elderly people. Because if you do just aerobic activities, you can improve the endurance, but I mean, you don't influence muscle strength unless it's extremely low. But strength training is really crucial. And those arguments from the past that it's dangerous, that there's a high risk of musculoskeletal injuries, and that the high pressure can cause some kind of cardiovascular complications, they are really not relevant. We know that if you do the resistance training properly, the blood pressure remains within a reasonable range, which is comparable to aerobic exercise. Even there's a kind of better effect in terms that the slight increase of diastolic pressure favors the perfusion of coronary arteries. So actually these like cardiac events in elderly patients undergoing the strength training are extremely rare. I mean, much less frequent than during aerobic training. And also the safeties, if you do it properly, the safety is perfect. And the benefits are huge, because imagine that, when, especially at the very high age, when these strain capabilities, they fall under what we call disability threshold. People start to have problems with daily activities. They have problems, to stand from the chair. At the beginning, they stand, maybe slower, but they still stand. But after that, they even cannot stand. That's just an example. A lot of activities are actually restricted or even impossible. The general, the general physical activity is decreasing. It's a kind of vicious circle that, the less activity, the worse strength, less activity. And the only way to break it is to do appropriate strength training. And then you have a lot of positive effects, like say on metabolism. You increase the sensitivity of insulin receptors. You increase the resting metabolic rate, which is usually the phenomenon that with the age you decrease the resting metabolic rate. And because of that, there's a tendency to have a positive energy balance, and people tend to increase the weight. So it's also a means, to cope with this positive energy balance as people get older.
Okay. All right. So you have spoken on endurance. So on a weekly basis, what is the ratio between endurance and resistance training? Like how often we should work out, how many endurance workout should we do, and how many resistance should elderly put inside their workout regime or workout routine?
There's a difference, between those two activities. In fact, you can do aerobic activities almost on the daily basis. Okay, they say 3 to 5, but if you do it 7, it's even better. It's not like that with strength training. Actually, in elderly people, we do not recommend to do more than maximum three sessions a week, because from this kind of training, you need to recover. All these recovery processes, they need some time. and those recovery processes in elderly people, they are usually a bit slower. So that's why one have to be reasonable, not to overdo the resistance training in elderly people or in patients.
So what kind of resistance training can elderly do? Should they lift weight like heavy weights or like a dumbbell, like
the general recommendation is, like theoretical recommendation is that they should do it something like 50 to 70% one repetition maximum. But this is something what doesn't tell much the, I would say, general consumer. I mean, normal senior doesn't understand it very much because it doesn't know, what his one repetition maximum is. Not to speak about it would be kind of dangerous to measure that in seniors. So very simple approach is that we recommend to do the weight or the resistance, whatever kind of device you use. You should use a resistance which the subject is able to overcome 10 to 12 times. So that says it's high enough to elicit some effects in terms of gaining strength and muscle mass, and it's still safe in terms of excessive blood pressure increase. So this is a kind of general recommendation. So the best way is in one session to do maximum 3 sets of these 10 to 12 repetitions with the weight you are able to accomplish, in 10 or 12 times. And you should do exercises on the major muscle groups like extensor, flexors of lower upper extremities and so on. In these respects, I like to stress that if you take aerobic exercise and if you give advices to general population, and when they are motivated and they are intelligent enough, they are able to, to start the program by themselves in some way. It's more difficult with strength training. We strongly recommend that, especially elderly people who never before, these kind of activities, that they hire a kind of personal trainer, knowledgeable, in this area. And he or she will help them, to overcome this critical period at the beginning of this strength training program.
Okay. All right. So exercise and aging is a big topic. So I have a question. Some people might be having Alzheimer as they started to age, right? So how can they prevent or maybe slow down the process of Alzheimer, doctor, in terms of aging, like when they go aging and then they started to have this Alzheimer? So how can they slow down the process?
There are very promising studies from recent years which shows clearly that the exercise intervention can postpone or slightly ameliorate the problems connected with these chronic degenerative diseases like Alzheimer or Parkinson disease. Okay, I mean the effect is not like a miracle that you cure somebody, but the studies clearly show that the exercise intervention can improve the cognitive functions, even not only in normal healthy people, but in also on those people who are affected by those diseases. So it's actually the only intervention which works. I know that the pharmaceutical companies, they are working on some miracle drugs, which would be a good business for them, but so far I think the exercise is still the only effective and fairly cheap means you can fight. Okay, you can prevent this disease. Again, I mean, there is no 100% guarantee, but okay, you increase the odds not to be affected by these diseases.
Okay, so Doctor, so you are going to be talking about the physiology of aging, right? In this WCEM, is it?
Yeah, that's what I have been asked for. So actually, I will kind of summarize the effects of aging on particular system of the human body, like cardiovascular, respiratory, immune system, digestive system, or reproductive system, brain functions. And not only to, like to summarize these changes, but also to look a little bit at the background morphology of those changes, and of course also some hints, how to slow down these negative changes which are
Doctor, can you give a
related to
teaser, like
aging.
a teaser a bit on how to slow down the process of aging, like a teaser?
Yeah, I mean the title of the conference, the whole movement says it. I mean the exercise is the key. Of course, also the other factors like nutrition plays a role and some other environmental factor. But what is good news that a lot of those changes related to aging have some genetic backgrounds. But what we know, that still a lot of possibilities to influence it by environmental influence. And of these influence, the exercise is the number one. So there's a good news that, of course, we have some genes, but we still can modify the effects. And I like the saying which is used in this aspect that says that the genes load the gun, but the environment pulls the trigger. Yep. You have, like for example, somebody may have a strong predisposition for type 2 diabetes. I mean, having the problems with the sensitivity of insulin receptors, but through appropriate exercise, that person can run away of this problem. I mean, it could be like this deficiency will never be apparent, will never have these negative effects. So that's very good news, very good message to everybody, that we shouldn't give up. Yep. We shouldn't all. A lot of people they take like, okay, that's a destiny, and what can I do? And then also, in many countries, and I can give an example from my country, because I used to live half of my life in kind of communist system, where the healthcare was for free, entirely for free. So patients, they tend to behave like, here I am, doctor. It's up to you to take care of me. It's not my business. It's your business. So it's entirely wrong. People have to be active. They have to contribute. I mean, the health is not for free. People have to be more responsible for their health.
Okay, thank you, Doctor, for your explanation. All right, so this is a personal question from me to you. So what is your trick to stay strong and active right now in your age? So can you just share something for us?
I can give you a little bit of my background. It's quite interesting. When I was young, during my student time, I was an elite athlete. I was a shot putter.
Wow.
I spent a lot of time in the gym, because as a shot putter, you need to be strong. And actually, those days, I mean, we never ran. For us, a shot putter, just ran 2 laps was already an achievement. In funny way, I remember the cases, some of my colleagues, and instead of warming up by running 2 laps, they took aspirin and hot tea. So that's really what I remember. Some of those did. So what I want to say, I mean, for us, running was aerobic exercise was nothing. But when I finished medical studies, when I started to practice medicine, I started to read that the aerobic exercise is good for health, and I was very skeptical, to be honest. But then I decided, okay, I mean, you have to see for yourself. So I've started running. Within a year, I ran marathon, and I was running for 30 years,
Wow.
almost daily. But as I was getting through these processes, and I abandoned totally the strength training. But some 25 years ago, I started attending conferences, and I started to listen that strength training can be beneficial. So I resumed the strength training again, and I do both now. And I'm an advocate of both activities, strength training and aerobic activities. So nowadays, I'm riding bike every day to my office and back. In Slovakia in winter can be harsh, but unless there's icy road or it's snowy, I'm still using bike. You just need to get the good dress. I mean, that's it. And
True.
I go to gym twice a week as I'm advocating. As a bonus, I mean, from time to time I play golf. But those combination of aerobic activity and strength training is extremely important. And I'm like in my country, I could retire already like 7 years ago, but they still want me at the university. Maybe they are just good actors. They pretend. But I'll be 70 soon, and I don't feel like that. I still
Yeah, you didn't seem
can
like
keep up.
you
I
still
still
strong.
still can keep up with my son when we do biking. So that's it. I mean, very simple. To be active. I mean, intellectually as well as physically. If you combine endurance, okay. As I always say, there's no guarantee,
Yep.
but you just increase the odds dramatically. So that's
True.
it.
Okay, so I think we can come to an end. Before we end our podcast, can you tell me and all the audience here, where can we find you and your work? Maybe on your Facebook or Instagram, or maybe any website that we can find you?
I'm old-fashioned. I'm not on Facebook.
Okay.
I know that I will disappoint a lot of audience.
Okay. All right. So,
but on the other hand, maybe I just mentioned one fact that as I was explaining, that we have been dealing with the effect of exercise in seniors for more than a decade, and as a practical outcome, we have applied for a grant to build a center of active aging. And it was quite difficult, to go through all the bureaucracy. But the good news is that we are going to open it in some 2 months. And it will be kind of center where the elderly people can come for the programs. And the center also has a aim, to be kind of place where the promotion of appropriate physical activities for elderly is like spread out, throughout the country, throughout the nation. So this is, I would say, a practical consequence, of our theoretical activities in the past. And as final words, we know a lot about these positive effects. But the problem is to make it work in the real life. And that means that many times the promoter of physical activity, they have to approach politicians, they have to do a lot of persuasion, a lot of arguments that they understand. We have now good arguments that it's kind of very cost efficient. If you invest into physical activities in long term, you can save a lot.
Yep.
But the problem is that many healthcare systems, as I used to say, they have not enough means to distinguish the fire in terms of, a lot of diseases and so on. And there is no money left, for prevention. But of course, we know that this should be right way. And it's also our task as a scientist, to bring this, to work in the real life, to make politicians change their mind, change the system of whole healthcare, In some countries, they are smart enough. Imagine that exercise in many diseases is more efficient than any drug.
Mhm.
I mean, the healthcare system pays for drug, but doesn't pay for the exercise,
Yep.
which would be much less. So this is a kind of controversy we have to use as an argument with politicians in order they change their mind and they open the space for applying more physical exercise in prevention.
Yep.
That's it.
Okay. So I think, thank you, Doctor. So I think we shall save some for the conference. For those who are watching, if you want to listen to Dr. Dusan Hamar presentation, please register to our 5th World Conference on Exercise Medicine, which will be held on 29th of October 2021 until 2nd of November 2021. To register for free, please visit our website www.wcem.com.my and book your seats now. I hope to see everyone at the WCEM 2021. So thank you very much, Dr. Dusan Hamar, for your detailed explanation on exercise and aging. Thank you again for being generous with your time. It is an honor. It is an honor for be your host to be your host for today's podcast.
I thank you to be a very, very generous, very excellent host for me. So thank you very much for the time and for having the possibilities, opportunity to speak out some
Yep.
opinions and concepts. Thank you.
Thank you. Okay, so I hope one day we can meet again physically in next WCM, or maybe when you may be visiting Malaysia after this COVID comes to an end.
That's definitely my wish. I mean, Malaysia is a country of my heart, so I mean, every time I'm ready to go there.
Okay, thank you. Okay, let's hope for the best, everyone. And thank you again, Dr. Dusan. And thank you again for everyone for attending this podcast today. I hope to see everyone in the WCM 2021 soon. Okay, thank you. Bye-bye.
Bye-bye.
Bye-bye.